Okay, let's go into more details with the trigger D Synchrony. And as we said, we can have either the patient trying to trigger the ventilator. Let me change this color. But the ventilator is not getting the signal. It's not getting to the ventilator. So the patient, you look at the patient in ICU intubated, the patient having some breathing and trying to initiate a breath using his respiratory muscle, but the ventilator is not delivering that breath. So you know there's desynchrony. Or could be the other way around, that the patient is not trying to breathe, so there is nothing coming from the patient, but the ventilator receiving some false triggers, so delivering a breath. Regardless what's this false trigger and how it happens. So the problem could be either way. So let's talk first about what we call poor triggering, which is the patient trying to trigger the ventilator, but the ventilator is not responding as we explained. Remember, there is flow trigger and there is pressure trigger. For the flow trigger, we set a threshold and a threshold here that the patient should reach this flow threshold in order for the ventilator to sense that the patient trying to breathe and for the ventilator to deliver the breath. The same thing here, has to drop the pressure by a certain amount. And please refer to my videos on flow trigger and pressure trigger. But quickly refresh your memory. Remember that we said the ventilator here, the ventilator has a inspiratory limb and expiratory limb, and they go to the AT tube, that the air, when the patient is not breathing, the air that going through inspiratory and expiratory limb to the ventilator is the same. If it's 10 liter here per minute, should be 10 liter here. Now when the patient breathes, it takes certain amount here, so in the expiratory limb will be less, let's say for example 7. So based on the threshold, you put maybe 3 liter at least difference. So 10 here, it has to be 7 here and 3 sucked in for the ventilator to be triggered. The same thing here, you put a threshold that the proximal airway pressure, PAP, which is the pressure that's sensed right here at the ventilator circuit. When we try to breathe, please go back and see my videos on pressure trigger. We drop the pressure in our chest, will get transmitted and will be sensed by the ventilator. Usually the ventilator put the threshold of -3 centimeter H2O, that there should be a drop by 3 centimeter at least that's sensed by the ventilator in order for the ventilator to trigger a breath. Now next video I'll go into more details about poor trigger and flow trigger and then pressure trigger.